I'm very pleased to be out of isolation, and I really would like to acknowledge all of those people in South Australia who have had to do isolation and quarantine. I know that it is a huge imposition, but these are the sacrifices that so many South Australians have made that have kept our state safe with a relatively strong performance in so many different areas in controlling this disease. So thank you very much to all the people that are continuing to do the right thing and abiding by all of those restrictions. So we'll start with the statistics and the update. Unfortunately, again, at the top of this presentation, I have to very sadly report 6 deaths in South Australia which have occurred in the 24 hours up to midnight last night. The full details of those I don't have with me at the moment, but we will certainly be providing them. The second statistic is the number of positive cases reported in the 24 hours to midnight last night, and I can tell you that this was 5,679. But we do need to have some caution, when interpreting this data, because we are told by SA Pathology that because the previous day we were getting our samples in much later, right through until midnight, because we were closed for hot weather between 10:30 and 5:30, it really meant that many of the samples that are reported today are samples from 2 days ago, not from yesterday, around 400. And of course, yesterday was the first day that rapid antigen tests were handed out by SA Health. And so we have 1,747 of those reported today being from the rapid antigen test. And of course, those people got their results, which normally would have come with a PCR test result tomorrow. They've been brought forward. So we need to look at today's total of 5,679 with a great deal of caution. It's likely to be lumpy for the next day or so and then smooth out. And certainly this result is still well within the model that we'll be going through later today. I can also tell you that yesterday we had 24,796 tests completed in that 24 hours. This is a huge number. It's up about 20% on the previous 2 hot days in South Australia. This puts us right at the top of the tree in terms of per capita testing right across the country. And I would like to just tell you that yesterday SA Pathology processed nearly 19,000 tests in a single day, and this is their second highest number on record. So congratulations to SA Pathology, but also all of our private labs in South Australia. The PCR test has been the backbone of our response to COVID since day one, and it's fantastic to have these great results coming through. In terms of hospitalisation, we have seen that number further increase to the 24 hours and at midnight last night to 246 cases. But the very pleasing news is that we're now down to 20 people in ICU. So 2 days ago we were at 27. We're now down to 20. Unfortunately, 8 of those 20 are now on ventilators. So a reduction in ICU, an increase of 1 on a ventilator, but also an increase in hospitalisation. I can also tell you that in terms of vaccinations yesterday, we had a very, very good day, 21,516. So in the 7 days to the 12th of January, we processed 129,000 vaccinations. This is a record. This is a record for South Australia for a 7-day period. But let me tell you, the challenge to South Australians is let's break it again next week. We want to make sure that we can continue to increase the vaccination of South Australians. We're opening up more and more appointments every single day. In fact, there are appointments available today at Wayville. There are appointments tomorrow and Sunday down at Wayville, and I really want to see every single one of those appointments snapped up. I want to see every single person that is eligible to be vaccinated as quickly as possible. We still see a massive over-representation in those ICU statistics for people who are not vaccinated. It's very, very clear. Those people that are vaccinated are less likely to transmit the disease, but they're also much less likely to end up in hospital or ICU. These statistics are very clear. They're not subject to dispute. The strong message to all South Australians who are not vaccinated yet is please get along. We're opening up thousands of additional appointments and we would love to see you there. In terms of the pickup of the rapid antigen tests, the 2 free SA Health provided rapid antigen tests that went extraordinarily well yesterday, and a couple of statistics for you. We had 4,310 vehicles through the site. Now, our maximum capacity, we believe, is around 8,000 vehicles per day. Yesterday, 4,310 vehicles. 20,266 tests were dispensed. Now, of course, there are 2 tests in each of those packs, so 10,133 people were able to use those packs over the next 6 days. As I've already reported, we did have a very significantly elevated number of tests done yesterday, and that was really bringing forward a lot of those positives we would have seen in the PCR results tomorrow and the day after, and so we have seen that elevated positive number in South Australia. It is mandatory to report a positive rat test in South Australia. We're very grateful that South Australians are doing the right thing. This is really important because it feeds into the data, that feeds into the forecast and the modelling, and that informs everything that we do in terms of putting the requisite resources in place for our plan to keep South Australia safe. I can tell you that the new rat collection facility at Berry Barmera will open on Sunday. We have 2 new sites at Murray Bridge and Port Augusta, which will open at Tuesday, and we'll be updated from the Police Commissioner about additional sites in the coming days. I can also tell you that in terms of staff within SA Health, we now have 557 who are COVID positive. So this is a slight reduction on yesterday at 574. We do see these numbers move around a little bit. Unfortunately, we now have 870 SA Health staff who are furloughed or COVID positive. So this is having significant effects on our workforce across South Australia. But as I've previously reported, many of these staff who are furloughed can help with our COVID response care team, the cricket team, which is supporting the tens of thousands of people now who are living with COVID positive, living in their own home environment. So that number, which looks quite shocking and is a huge strain on our already stretched resources within SA Health. It is one which we can utilise. Many of those people are still rolling up their sleeves and helping us, even though they're in isolation or in quarantine.